Meet Mary.
I woke up yesterday not feeling quite right. I ate breakfast and I went to work. By noon, I had a dull, achy pain just above my belly button, which caused me to skip lunch. The pain became worse in the afternoon, so I went home early. After a bowl of soup for dinner, I went to bed, but I couldn't sleep because of the discomfort and feeling of nausea. I took a sleeping pill, which also didn't help. It hurts on my lower right side.
Gather equipment. You will need examination gown, a drape, clean, non-sterile examination gloves, a stethoscope, a skin marker, a metric ruler, and a tape measure. Complete a physical assessment of Mary's abdomen. Ask Mary to void prior to the assessment. Physical assessment steps include inspection, auscultation, percussion, and palpation. Inspection. Mary should lie down in a supine position with a pillow behind her head and knees. The assessment should be conducted on Mary's right side. Inspect for contour, color, position of the umbilicus, location and characteristics of lesions, symmetry, bulging or masses, and movement of the abdominal wall. Finding of Mary's inspection include she is guarding her abdomen, grimacing, and has her legs flexed at the knees. Auscultation. Auscultation is conducted to assess bowel sounds, vascular sounds, and for friction rubs. The diaphragm of the stethoscope is used to auscultate bowel sounds. The bell is used to auscultate for vascular sounds. Normal bowel sounds are high-pitched, irregular, and gurgling, occurring approximately 5 to 30 times per minute. Bowel sounds are present in all 4 quadrants in Mary's abdomen, with regular vascular sounds on renal, iliac, and femoral arteries. Percussion. Indirect percussion is used when assessing the abdomen. The abdomen should produce a tympanic or hollow drum-like sound. Mary's abdomen was percussed starting with the right upper quadrant, left upper quadrant, and lower left quadrant with presence of tympanic sounds. Mary's right lower quadrant was not percussed due to complaints of pain. Palpation. Palpation of the abdomen includes light and deep palpation to identify the size of organs and to identify masses or lesions. Tender or painful areas of the abdomen are palpated last. In Mary's case, palpation of the right lower quadrant was not performed because of pain and the risk of rupturing an inflamed appendix. She was sent immediately for a CT scan. Due to the sudden onset and localized right lower quadrant pain, it was suspected that Mary was suffering from appendicitis. After her CT scan, it was confirmed she was in need of an emergency laparoscopic appendectomy.